Phase 2 of the vaccination drive continues. Over 160,000 vaccines have been administered, and officials encourage the elderly to register for their jab. Some have raised concerns that they're facing challenges with the actual registration process. So how does the government plan to solve these challenges? Let's unpack this further now with Dr. Nicholas Crisp from the Department of Health. Dr. Crisp, a very good morning. Thanks so much for your help. So what are the problems that were experienced during week 1 last week of vaccinating the elderly? What were the major ones, and how have you managed to solve those?
Morning, Rebecca, and everybody who's listening and watching this. Obviously a massive rollout like this does have its challenges. So perhaps just to note to the public that we apologize for the sites where there were glitches. I guess it's to be expected in the first week, and we hope that the lessons that we've learned from people sending us information have helped us to improve every day. The initial challenge was changing over from the Sisonke system to, of the J&J study to the new vaccine rollout. It's a different vaccine. It's a different process. There are different sites. It uses the same EBDS scheduling system. So having to shut down that system, do an immediate reconciliation and switch on the new system took longer than expected, and we were not able to complete everything before the start of last week, and it was late into the weekend. And that resulted in the late sending out of SMSs for people who had to come on Monday, and also because instead of the sites being able to control their own messaging, they were not already around the country, and we had to push messaging from the center, and it made it difficult to target the messaging. That has now been addressed, and most provinces and a lot of the private sites have, during the course of the week or over this weekend, got control of their own scheduling. And what they do is they prepare the schedules, the numbers of vaccinees that they can see, and they load that onto the system, and then the EVDS system sends out the messages from a central point, but based on what they are recording.
Okay, Dr. Crisp, I just want to give you sort of my parents' experience last week, and maybe it was because of just the complications you experienced. I mean, they got a message at close to 10 o'clock on Monday night to say that my mum only needed to be somewhere to get vaccinated at 2 o'clock the next day, and only her, not my dad as well. So, that raised questions of why not 2 people from the same household who can come. What happens, I mean, if you get such a late message for an elderly person who isn't able to get to that site the very next day within 24 hours as well? Was that part of the challenge? Will that happen? What are sort of the explanations for that, or was that just because of what was being experienced last week in terms of your problems?
Yeah. No, absolutely. So the first couple of days, as I mentioned, we had not managed to get individual sites with all their managers and administrators trained to do their own scheduling. So rather than leave them closed, we got some figures and were able to push out messages from the center, from the national system. And that went out late. And of course, when you're not targeting to the specific capacity of a site and you're working on a sort of more shotgun approach, there were lots and lots of incorrect quantities and so forth that were sent out. So that was a unique problem to the first couple of days. There are still 1 or 2 places in the country where the individual provinces don't have full control of their scheduling, but they are giving us more accurate numbers now, and the SMSs are going out earlier.
Yeah.
In time, the SMSs should go out at least 2 days before, and we will see what the reaction of the public is, whether that needs to be extended to an even longer period. The system is extremely versatile, and in fact performing exactly as we hoped it would, but it's making sure that all the many people who are involved in the periphery are able to control, are trained and understand how to control their own scheduling and respond to their own challenges. Of course, what they're trying to do is match their resources, their vaccine and their staff and everything, to the number of SMSs they send out. And
I suppose the other concern for many people, like you say, you might have to look at maybe a bit more of an advanced warning or notification. What happens if somebody has missed their vaccination now? How is that rescheduled?
Yeah, so this has been spoken about by the Minister in some of the press releases, so I'll emphasize. So an initial SMS goes out, and people may not be able to attend that appointment. the system recognizes that they did not come to that appointment and immediately reschedules them for a second appointment, and they go placed in the front of the queue. Now, people need to understand the front of the queue means that the queue is shifting all the time. So the front of the queue is not number one because others have already been sent SMSs, but it's very close to the front of the queue. If an individual is unable to attend that second appointment, the system will again do the same thing. So there are 2 reappointments plus the initial appointment are generated automatically in the system. But there will be people who are abroad or at work or are ill or in hospital or whatever who are unable to attend any of those 3 appointments. The system does not delete their records. We know that they are registered, and the system will park that record until they either make contact with us or on a scheduled basis, we will try again to make contact with those people.
Okay. Well, Dr. Crisp, also, those people, I mean, we understand that these appointments are given based on your area, what's closest to you, vaccination sites. So with pharmacies coming on board now, for example, Dis-Chem opening up sites tomorrow, we understand. If I choose that I want to go to a particular Dis-Chem or my local Dis-Chem as opposed to the site that might be given to me otherwise via the system, how does that work? Or can I choose?
Okay, so obviously what's happening is as more and more sites come online, you are likely to be, there's a better likelihood of you being within the drainage area or the supply area of that site. So what the system is doing is looking for people within 10 kilometers of a particular site, and it is not taking personal choice, it's except for whether you said a morning, an afternoon, or a weekend slot, and the location that is recorded on the system of where you are in relation to those facilities, and then it's queuing you on that basis. If you want to pick and choose because you know a site has come on near to you, you would have to go to that site and ask them to schedule you.
Okay.
So, look, I wouldn't recommend that. It's obviously better if we all just go with the flow. The numbers of walk-ins of people who didn't get SMSs and just arrived at sites created a lot of trouble in this first week. And we honestly want to just ask people, we know about you, you are registered. If you've received the registration number, you will get an SMS when there are sites available for you. And it is better to be patient.
All right. So those pharmacies, for example, those Dis-Chems are all linked to your system. That will also send me to that if that is closest to me. Okay.
All provinces, everything that you hear in the media about a particular province or a site, the various providers within the private space, we are working together with all of them. They are all on the same system. They're doing the same scheduling, and their appointments are all made from that central system. And it's the only way we can follow and keep control of the doses that are allocated and make sure that there's fairness in this process.
All right. Would I be able to register if I'm under 60? Can I still just register now for the next phase or not? It's only for not at the moment.
If you try to register and your ID number shows that you're under 60, you won't be allowed to register yet, because we know that in terms of best impact, in terms of reducing the amount of danger or morbidity that can occur in the community, targeting everybody over 60 is the most effective way to release the pressure on our health system.
All right.
So until we are confident that we have addressed sufficient quantity or full proportion of those 60s, we won't open the system to another age group yet.
And in terms of your number of operating sites, vaccination sites that are open now, how would you sort of give percentage-wise? How many of them are fully operational and running the way they should be?
Sure. It's rocketing. You know, I was trying to keep track of what was happening over the weekend. Teams were still sending messages at 11 o'clock last night, so there are still sites being brought online all the time. I haven't done the tally of what's available for today, but it is more than double of what was last week. So we expect that to continue, and the Minister has announced that we are ultimately targeting to get up to 3,000 sites. We obviously have to be careful how we bring sites online, because we're now shifting vaccine around and moving that vaccine and the logistics process of getting it to where it can be distributed and stored and managed has to be dovetailed with the speed at which we bring new sites online. So we are still getting into the rhythm of this during the course of this week, but it is increasing as we speak.
Right, Dr. Nicholas Crisp, thanks very much for that, from the Health Department, just helping us understand how the process is working, admitting that there were some problems last week which are in the process or have been ironed out or in the process of being ironed out at the moment. Patience is what is needed here. Well, let's move on.